last year. So health care is certainly on the minds of many, but hasn't really been so much in the headlines the last week or so, especially with the State of the Union address. In fact, it really wasn't addressed all that much in that speech. Our insurance expert, Craig Gussin, joins us here this morning. Were you expecting to hear more about health care in the President's State of the Union address?
I was, but I think he just touched it and went on because he didn't want to go there.
He just doesn't even want to deal with it now. It's probably one of the biggest things facing the nation, and it really didn't get much airtime.
Yeah, I think he just left it and hoping everything gets fixed and gets better.
All right, just give us an update, and then we'll get to some of our viewer questions here. Where do you think things stand in terms of, is it smoothing out? Are there bigger problems still to come? Where are we?
The issues right now is that everybody has applied, sent in their applications, supposed to get a 1/1 effective date. And we're at January 30th today?
Yes.
Yeah, okay, so we're at January 30th, and a lot of people still have not been approved. People are just barely getting ID cards. They're still far behind. You're not hearing that outside of Covered California. But on our side, we're getting calls every day. One of the biggest issues right now is they're requiring almost everybody I talk to prove that they're a U.S. citizen. And I'm talking about people who are born here, and it's like, why are we going there?
Now, this is an administration that won't require people to provide any ID in order to vote.
Right.
But they're requiring people to prove U.S. citizenship?
U.S. citizenship, you got to prove your income, which really makes me crazy because if you think about it, your subsidy is based on 2014 income. Who cares what you made in 2012 and 2013? It really doesn't make a difference.
I guess but they're trying to estimate what your subsidy would be. I can see maybe trying to get out in front of it a little bit.
Right.
So that people don't underreport.
Right. But the problem is that nobody knows, especially if you're self-employed. You could make $100,000 in 2012 and make $40,000 in 2014.
Right.
It's just really a nightmare, and it's what we're dealing with. And so people go and they send it in and say, okay, I expect to make X amount of dollars, and then they find out, well, we're going to give you a lower subsidy because of your income tax. And you're going, but that was last year. That has nothing to do with this year. So it's been a big problem.
What's the next group to get a big shock?
The next group is going to be people who try and buy health insurance after April 1st. There is no way to buy it unless you have a qualifying event. You get married, you have a baby, you want to add your spouse or child to the plan, you lose coverage. But if you just call me up out of the blue and say, I want to get health insurance, and you haven't had it for a while, you're not going to be able to buy it until January. That and then group health insurance. Most people got a December renewal on the group insurance for groups under 50, and then December, probably September, October, we're going to start seeing what the rates are. And from what the insurance companies tell me, depending on how bad claims experience is, who knows what those rates could be. They could be really high. It's going to be wait and see.
Okay, well, let's get to a couple of quick questions here.
Okay.
I applied for health insurance directly with Blue Cross, and I was told to buy Pediatric Dental Insurance, even though I am 30 years old, single with no kids. What is that? That's Cindy in PB.
Yeah, so every plan outside of Covered California for individual coverage must include pediatric coverage for kids. Even though
you don't have any kids.
Even though you don't have kids, even though you may have your kids, but they're all over 21, it still doesn't make a difference. It's going to help subsidize the people who have kids.
Okay, let's talk about that, because they're putting a label on that subsidy. They're making it very obvious.
Right.
You're never, ever going to use this service, but you're going to pay for somebody else who does.
Exactly.
This sounds to me like it's well on the road to a single payer, one government insurance plan. I mean, isn't that what it practically is at that point?
Unfortunately, the way it's designed, sometimes you think that, yes.
Okay. Why does my doctor say that he does not take Covered California when I have a Blue Shield plan bought through Covered California? Covered California is not health insurance plan? That's John in Claremont.
Yeah. Covered California is not a health insurance plan. They're just the administrator of it. You go through them to get the subsidy. Doctors think that if you have a Covered California plan, you're going to get paid less money than if you just go directly to the insurance company. I had a conversation yesterday with Blue Cross, and it's in writing. They pay the same to the doctors, regardless if it's a Covered California plan or if you went directly to Blue Cross and got it directly
the doctor will be compensated exactly the same.
Exactly the same. But every day we get these phone calls. My doctor says you won't take this plan because it's Covered California. They just don't know. We got to get the doctors and the insurance companies to talk together and understand that.
Okay. Craig Gussin, thanks for coming in.
My pleasure.
Again, hopefully we'll see you next week, and hopefully we'll get a little bit of good news here
I
once
hope
in a while.
so.